This is Dr. Blake Raggio, facial plastic surgeon here in Montgomery, Alabama. Got a lovely patient with me today. You might recognize her. She is my wonderful esthetician, Miss Mikola King here, who has volunteered to be a model for us today. So today we're going to be talking about the common applications and also the not so common applications of both filler and Botox. And we'll kind of depict here on Mikola what exactly are some of the areas we can target as we start to maybe get a little up there in the aging process, or maybe start to see some lines or wrinkles that you don't like. And of course, Mikola doesn't have all these things I'm going to be talking about today, but it's just going to be for demonstration purposes to better inform you what we can and can't do with Botox and filler. Okay, so when we're looking at the face, when we're doing our facial analysis when patients come in, I like to have them animate. So what I mean by that is we'll be doing a series of, I guess, expressions. So the first one I like to have patients do is to show me their surprised look. Raise your brows up to the sky. Yes, and as you can see, Mikola does have some hyperactive frontalis muscle that's causing her to get some of these lines in her skin. Now relax. So even though she doesn't necessarily have these at rest, over time, as she continues to animate, these lines will try to be etched in the skin. And once they do that, they're much harder to treat. So that's where a prophylactic use of Botox or therapeutic use, if you do have those wrinkles, can target that muscle. So once again, that's the frontalis muscle to target those forehead lines. Give me that surprised look. Yes, very good. Now relax. The next part we like to target is this area, which we like to call the glabella. So Mikola is giving me kind of that frown face, or if you lower your brows real strongly, and hers aren't terribly strong, but what can happen is you can get these prominent lines, sometimes called the 11 lines, that are result of basically the activation of those muscles. So that's another common area to target, and the reason I like to target this too is because these muscles only have one move, and that is to pull down. So that move down only gives you a tired, sad, angry look. None of that is what we want people to have. So by relaxing this muscle here, we can get a little relaxation and get a little more lift to the brow medially and get a better overall aesthetic look to the appearance of the face. So another common area besides the frontalis and the glabella are going to be the crow's feet. So if you turn here, when we talk about the crow's feet, it's a muscle that circles the eye here that we're targeting, the orbicularis. So there's a muscle that we're targeting around here, the orbicularis muscle, and its action causes wrinkles that you see commonly called the crow's feet. So give me that nice squinty look. Yes, ma'am. So as you can see here, these are kind of the common radial pattern of these crow's feet. Now you have to be careful sometimes. Mikola has nice full cheeks, and so when she smiles, big smile, she actually has wrinkles that extend up to here. So be careful that you don't chase these onto the cheeks, because that actually is probably not a good use of Botox. So once again, the crow's feet is really what we can target here to really try to soften that smile and really kind of create a more refreshed look to that face. All right, now back to the kind of midline part here. Mikola is going to do a little bunny face for me. Yes, now relax. So you can see those lines that kind of came in here. Do it one more time. Yes, relax. These are kind of little lines that we call the bunny lines from a muscle that runs in this direction, but essentially we like to target those as well when we're doing any Botox injections around the midface. Now sometimes injectors like to, or at least I like to, for instance, target the tiny little crepiness underneath the skin here. You can see when Mikola, actually chin down Mikola, let's see. At rest, Mikola kind of has a tiny little crepiness to the skin here. That just means that kind of thin, lax skin. Sometimes it's due to the actual skin integrity itself, but sometimes it can actually be due to the muscle. That same muscle that's causing these lines can be causing these lines. So make sure your injector is experienced, and when he does inject, there's just tiny little aliquots that you're putting underneath the eyes there. It can be a very nice touch, kind of the icing on the cake around the eyes. All right, so we've kind of covered the more common areas of Botox. This is when most people come in. This is what they're familiar with. Now we're going to talk about a few of the more uncommon applications, which we'll kind of demonstrate here on Mikola. Now sometimes you might have people come in that often have a gummy smile. Smile, Mikola? Show me some teeth. So she's got a nice smile, a very kind of classic Mona Lisa smile, as we call it. That's the most common smile we have. Now sometimes people can have, if you smile, will have what we call a gummy smile, where you get this pull like that. And I know that was very artificial and unnatural what I just did, But essentially, people who have that gummy smile, we can target with Botox by putting tiny little applications in this area here to soften that muscle that pulls that smile up. So that's a nice little adjunct procedure for folks who have that gummy smile. Another thing you can do, and this is becoming more popular nowadays, is something called a lip flip. What essentially you try to do with a lip flip is you inject Botox around this muscle, the orbicularis oris, around the mouth, that will allow you to get a little more pout on the lip. By relaxing this muscle, it allows this to roll out and furrow out this way. And of course, a little more red lip is definitely a little more of an attractive look, a lot more youthful, more voluminous lip is just something we all appreciate better. So that's the lip flip. Other things you can do around the perioral region, you can definitely do something called the chin dimple, or the peau d'orange, which is French for the orange peel, because sometimes people who have a hyperactive muscle here will actually get a little chin dimpling. So I'll have Mikola pout for me. Actually, do that face where you pull your chin up to your nose if you can, kind of like that. And I'm trying to do it, have her do a few expressions here, where I can see she has a tiny little bit of chin dimpling here. And some people it's a little more prominent than others, but for her it's really not terrible. But that requires just a few little injections here, which can be a nice change. Now, other times, for maybe folks who are in their mid-50s, maybe a little later, they can get a little downturned corner to the face. Now, that can be because hyperactive muscle action, particularly these muscles that depress here. So with Botox, by relaxing this, it'll pull those muscles up, and you'll basically kind of get that more neutral or even an upturned look to the mouth, which of course is more natural and pleasing overall. Now, we're not done yet. If we look over here, I want to focus in on this muscle area called the masseter. So if you turn back here too, I'll have Mikola bite down and relax, bite down and relax. Now, it's hard to appreciate, but I'm targeting this muscle that's right here along the jawline. It attaches right at the jaw and attaches up here on the zygoma, but essentially this is a big chewing muscle. And when people have overactive masseters, they can either suffer from not just a look where you get a more boxy look to the face. Mikola really doesn't have that, but I'm talking about folks who kind of have that chipmunk look. Now, some folks also suffer from teeth clenching, or bruxism as we call it, or grinding their teeth at night, and it can be actually very painful. And Botox is a great application to soften or weaken that muscle. That can also help that TMJ related symptoms from the teeth clenching. So that's a great application of Botox that a lot of people don't think about. Now, another thing that's not as commonly used but still very helpful is we can actually help accentuate the jawline with Botox. Now, how do we do that? There's actually a muscle called the platysma muscle that runs just like so, more or less, and it stops right here in the middle of the neck. In fact, I'm going to have Mikola kind of give me a face where she, yes, look how strong her platysma is here. You can see these muscle bands, and it actually is dehiscent in the midline. And so what we can do with Botox, once again, is we relax these muscles to where it allows it to just sit in a more natural plane adherent to the underlying structures. So when Mikola's already got a nice youthful jawline, there's not much I could do for that. But you might notice, and I know there's a lot of markings here, that she does have a few little necklace lines, as we call them, these little transverse or horizontal lines here. And that is just a combination of just black skin, the texture's not as strong as it used to be. She might just be very animated. There's a lot of reasons behind it. But what we can do, and I may show this a little later, is we can do something called hyperdiluted Botox, to where you can dilute the Botox, and it's a very, I guess you're injecting a lot more than you would in the other areas, at least volume-wise, and you can scatter it out over the entire neck to really try to relax the pull of that platysma muscle and thus soften these necklace lines. So that's something called baby Botox or meso Botox. It's got a lot of great applications that a lot of folks don't know about. So just to recap real quick what we've talked about, everything we can do for the face on Botox essentially ranges from the frontalis muscle here, the glabella complex, the nasalis complex, the periorbital region, including the crow's feet. And while I'm talking about it here, I almost forgot the brow lift. A lot of folks come in wanting more, wanting more of a brow lift or arch to their brow than they normally have. Now Mikla's got a nice arch to her brow. Typically you want it at about the peak of the brow. You want it to match basically parallel, or perpendicular I should say, to this lateral part of your eye. So for Mikla, she's got a nice peak of her brow here. I really wouldn't do anything for her, but if we were to try to get a little bit of a lift, we would essentially target some small little Botox applications right into the brow area. So that's a nice application. So once again, the crow's feet, the nasalis, we can do that gummy smile. The little lip lift as well is a nice application for, yes, the peau d'orange, or the chin dimple. We can do our masseter injections. And then lastly, we can do our jawline enhancement, or sometimes these platysmal bands or necklace lines here. And yes, last but not least, the downturned corners of the mouth, we can raise those up as well.